our group has not been uniformly sending this assay.
Okay, thank you.
So I think another question that comes up is this issue about risk of developing a new cancer in your opposite breast if you have a breast cancer and have a germline genetic mutation. This comes up a lot because we see patients now, we're certainly promoting a lot of genetic testing. So we find, mutations that can suggest you have a risk of developing a hereditary breast cancer. But if you've already had one breast cancer, the question is, what's your risk of getting another one in your other breast? And should that impact your decision about removing your other breast, in addition to more intensive surveillance with screening? And so this analysis actually tried to look to define that with different mutations. And so here, I think this was a really interesting analysis. So they looked specifically at one mutation being BRCA. And it did show that if you looked at people who had a mutation compared to not, certainly your risk of developing a contralateral breast cancer is substantially higher than the average population. You see it's about 23% for getting a breast cancer in your other breast, or 17% in BRCA2 compared to BRCA1. And so I think this is consistent with data we have previously seen, where we've usually thought that risk is in the 20 to 25% range. But what about other genomic alterations where we haven't had this data so clearly? Here you can see ATM doesn't seem to have a significant increased risk compared to someone without a mutation for developing a contralateral breast cancer. CHEK2 has been a bit controversial, and here you can see that CHEK2 carriers do seem to have a bit of a higher risk, not to the level of a BRCA mutation carrier, but about an 8% risk of developing a contralateral breast cancer. What about PALB2? It's interesting that with PALB2, I had always thought it was pretty similar to BRCA, but in fact, I was wrong, because this is true only for patients who had an ER negative first breast cancer, where the risk of developing another breast cancer in the opposite breast is around 20%, but not as high for the all-comer PALB2 patients. So maybe a little lower, for example, in someone with an ER positive PALB2 mutation. So this is the ER positive data, again, lower there. So, here I think this little chart is helpful because it looks at cumulative incidence of developing a contralateral breast cancer based on your menopausal status, really suggesting that the young women who are premenopausal, if you look at those numbers in the column to the left, you do see risk of developing a contralateral breast cancer, can be high in someone with a BRCA mutation or CHEK2 mutation. But as you get older, that risk of contralateral breast cancer in the postmenopausal setting is a little bit lower. And so I think very important information for counseling women about making decisions with regards to prophylactic surgeries and with regards to surveillance, knowing this risk.